My name's Jessica, and I work at an oral surgeon's office. That's kind of why I'm wearing these scrubs, so I guess it kind of goes with my presentation today. So, what I do at my job, or what I guess what my boss does, is we do a lot of wisdom tooth extractions, which I'm sure most of you have had yours out. It's around the age that we are. We do jaw fractures. That's actually where I came from today. A little old lady had been smashed in the face and broke her facial bone. So that's what I've been doing this afternoon. And then we do a lot of implant surgeries to where if someone loses a tooth, we put an implant and then they'll have a crown that gets built onto that. But my main focus is to tell you about the wisdom tooth extraction process, not the surgery details, more of the surgery process. It's pretty important to get your wisdom teeth out to begin with. If you keep them in there for your whole lives, if they end up coming through the gums, you could get infected by that happening. It's really hard to reach your toothbrush back there and get your back molars as is. So with your wisdom teeth, if they're coming up and barely through the gums, plaque and infection once they get trapped underneath the gums. My personal experience with my wisdom tooth surgery, I went to sleep, I woke up, don't remember anything but the ride home and my mom telling me what I did. So I just kept going like this. Just kept going like this. And she said, "What are you doing?" And I said, I don't know, I just see two of everything. That's what I was doing. I saw double of everything, which many of you may have the same experience. So coming to our office, you're going to be coming with a driver, and you're going to be under general anesthesia, which that will be planned for before you end up coming to our office. There's 4 types of anesthesia that you can choose from in our office. One of them is a local anesthesia. That's just where you get the numbing shots in your gums. And your numb is usually like whenever you get a filling. That's what they do. There's a second option to where you have a nitrous or a laughing gas, as they call it. And then the next step is a IV sedation. It's like a twilight state of being. You kind of know what's going on, but you don't really care. Sometimes we choose that for the older people that have surgery, just so that we can kind of keep an eye on them and wake them up if they need to. And then the general anesthesia is the highest level of anesthesia that you can get in our office. That's typically what people choose when they're getting their wisdom teeth out due to pressure and noise and nerves, all sorts of things that go into why you would choose that for yourself. So once you get there, you fill out paperwork, and then we take you back to the surgery room. You watch the video, and then you fill out the consent form during the video. The consent form is scary. There are lots of scary things on there. I get told every single day how scary the consent form is. The risks, the nerve injuries, death. Someone somewhere in the world is the reason why we have one of those scary things on our consent form, because they, I don't know, sued after something happened like that. And then we give you post-op instructions. Once the video is over, one of the assistants, myself, will come in and give you post-op instructions on what to do for after surgery. We give you prescriptions. You'll have 3 prescriptions to go home with: pain medicine, anti-nausea medicine, and rinse. You're going to have gauze to go home with, and with wisdom teeth, we send you home with a wrap that goes on your cheeks. I didn't have one, but I actually wish I would have, because it's pretty helpful. It just sits right on your jaw lines, and you're set for the day, the next couple of days. Keep your head elevated, change the gauze out as needed. It's I think, basic aftercare instructions of getting a tooth out, but some people just don't like it. So you also have a sheet to go home with as well. And then the doctor will come in and he'll go over a few things, the risks, your risks personally, and then also just the risks. And then afterwards we'll get your payment and then we'll get started. We get you hooked up to the heart monitor so that way we can keep a track of your heart and your vitals and everything while you're under. And then you'll get the IV started in your arm. We'll push some drugs in our office. We use Versed, which is like for forgetful medicine. We'll use fentanyl, which is a pain medicine. And then Zofran, Decadron, propofol. There are many drugs involved in just one simple procedure. Wisdom tooth extractions take about 5 to 25 minutes depending on the extremity of your wisdom teeth, if they're impacted or not impacted as much. And then the wake-up process happens and you go home. The wake-up process is not as crazy as everyone makes it out to be. So then we send you home with your driver and you're on your way. Some basic tips for getting your wisdom teeth out. Don't do a lot of research. Don't psych yourself out. Don't watch those stupid YouTube videos because most of the time they're not even true. Nicki Minaj, the inappropriate one that's more recent, more than likely they're faking it. A lot of people fake it. I've had many fakers and just want to hurt them because I don't like you faking it. I mean, yes, you're going to get the medicines to make you kind of goofy, and if you felt like that for the first time, then sure, you can egg it on a little bit, but more than likely, you're just going to do what I did, be clueless, and then go home. I don't consider myself an expert on wisdom tooth extractions. I wouldn't want my boss to think that anyways. I do enjoy what I do. I like what I do, but it's just my job, so